Hello, everyone. I'm thrilled to welcome you to today's webinar on one of the most transformative topics in healthcare today, interoperability. My name is Viri DeRuiz. I'm the Associate Director of Business Development at Abarca Health. I have over 20 years of experience in the healthcare and pharmacy industry. I've seen firsthand how seamless communication between healthcare systems can revolutionize patient care. Today, we're diving into how interoperability can improve patient coordination, clinical outcomes, and enhance patient satisfaction. We'll dive into Abarca's virtual PBM model and discuss how it's unique and solving challenges in the industry today. I'm joined today by my partner, Kat from Surescripts, who will be sharing more about Surescripts and how we partner today to supercharge interoperability. To optimize your time today, we've made this webinar shorter. Our content today will be delivered in approximately 30 minutes to focus on key insights in a prompt manner. So let's get started. Next slide, please. I'd like to start by briefly introducing today's webinar sponsor, my employer, Abarca Health. Abarca Health is a forward-thinking pharmacy benefit manager dedicated to transforming healthcare through innovation, technology, and personalized services. Founded with a mission to challenge the status quo and deliver better outcomes for our clients and their members, we offer a full suite of PBM services, including formulary management, benefit design, network administration, claims processing, rebate administration, and clinical programs, just to name a few. Our solutions are tailored to meet the unique needs of each client, whether they're a health plan, employer group, or government program client. Today, we serve over 5.3 million lives nationwide, both in the commercial and government program space. We've seen a tremendous amount of interest in our product and services, and as a result, we expect significant growth for 2025. But what personally drew me to Abarca is our unique cloud-based platform, Darwin. Established in 2005, Darwin stands as a testament to our long-term commitment and expertise in the PBM industry. Unlike many competitor models that only emerged in recent years, our platform has a well-established track record. Darwin is not just innovation, but it's also proven. Having successfully processed millions of claims seamlessly, this reliability instills confidence in our clients, knowing they can trust our platform for timely and seamless implementations. Our experienced implementation team ensures a friction-free process, reinforcing Darwin's reputation for excellence and dependability. As we continue the presentation, I'll expand further on some of the unique benefits our platform brings to the table. Next slide, please. Today's topic focuses on interoperability, a buzzword you may hear a lot these days. But what does it mean and how does it play a role in healthcare management today? Interoperability is the ability of different healthcare information systems to communicate, exchange data, and use the information cohesively. Effective interoperability allows different healthcare systems to share patient health information easily and securely among each other. According to the West Health Institute and the Office of National Coordinator for Health Information Technology, in the United States, we lose about $30 million annually due to the inefficiencies related to healthcare interoperability. With the egregious cost of healthcare and drugs today, that's a big opportunity for us to lower healthcare costs and create a more effective healthcare experience for the members we service. This slide does a nice job of illustrating the different chefs in the healthcare kitchen. We all have a different purpose, whether it's paying for services rendered, or diagnosing a disease state, or filling a prescription. We all play an important role, and we share the same goal to help optimize the health of our patients. Next slide, please. We just established that regardless of our role in the healthcare ecosystem, we share the same fundamental goal, helping patients optimize their health. Given the shared objective, it's clear that we should all be invested in enhancing interoperability within our respective realms. Whether you're a health plan payer, a pharmacy, a doctor, a consultant, or a PBM, increasing interoperability brings significant benefits to us all. So let's dive into some of the benefits that can be realized through enhanced interoperability. The first benefit is enhanced data sharing in real time. Interoperability is a transformative force in healthcare, really allowing us all to be connected, ensuring access to comprehensive patient medication histories, reducing the risk of adverse drug interactions, and duplicate therapies. Then there's real-time updates. Pharmacists and healthcare providers receive real-time updates on patient prescriptions, medical history, and formulary changes. This really enables us for more informed choices and timely interventions. For example, consider a patient with chronic conditions like diabetes and hypertension. This patient visits both a primary care doctor and a specialist. The primary care doctor prescribes a new medication without knowing the specific that the specialist perhaps already prescribed a similar drug. This duplication can lead to adverse effects or reduce efficacy of the treatment. With interoperability, both providers can access the complete medication list, ensuring coordinated and safe patient care. The second benefit is better cost management. The most common question we may hear from payer clients is, why did the trend go up this quarter? Drug utilization management is important. Inoperable systems can enable comprehensive monitoring and analysis of prescription patterns, which helps PBMs and healthcare providers manage drug utilization more effectively. For example, consider a large health plan that noted an upward trend in the prescription of high-cost brand name medications for hypertension. By leveraging inoperable data, the PBM can analyze these prescription patterns across its network of providers. Upon analysis, the PBM identifies that a significant number of these prescriptions could be substituted with an equally effective generic alternative, which typically is less expensive. Armed with this data, the PBM collaborates with healthcare providers to promote the use of these cost-effective generics. They provide educational resources and support tools to help providers make informed prescribing choices. This approach really leads to better cost management and also ensures the patients receive appropriate and effective treatments tailored to their needs. The third benefit is enhanced personalized care plans. Inoperable data is not only about managing current medications, but it's also about crafting personalized care plans tailored to the individual patient's needs and their medical histories. For example, consider an elderly patient with a history of heart disease and recent surgery. This patient requires a carefully balanced medication regimen to manage heart health while avoiding adverse interactions with post-surgery medications. With integrated data, the healthcare providers and PBMs can collaborate together to develop a personalized medication plan. They can review the patient's medical history, their current medications, and potential risk factors to tailor a treatment plan that addresses this patient's specific needs. This might include selecting medications with fewer side effects, coordinating medication times to avoid conflicts, and scheduling regular follow-up to monitor the progress of that specific patient. And perhaps it's something as simple as engaging the member in an MTM visit for more personalized care. By leveraging integrated data, healthcare providers and PBMs can ensure that the care plan is not only effective, but it's also manageable for that specific patient, leading to higher satisfaction and better adherence to the regimen. The fourth benefit is reduced administrative burden, which also leads to enhanced processes. Automated data exchange between PBMs, pharmacies, and healthcare providers significantly reduces administrative burdens, such as manual data entry and paperwork. This streamlining leads to lower cost and fewer errors. Take prior authorizations, for example. At the start of my career over 20 years ago, I was a retail pharmacy technician. I remember the cumbersome process of requesting a PA. I had to create the PA request, print it, fax it to the doctor, and then wait for the doctor's office to process the request and return it. It was really a time-consuming ordeal. Today, thanks to the inoperable systems, this process can be automated and expedited. The average electronic PA is processed in less than 48 hours. Healthcare systems without integration process PAs in 5 to 7 days. Electronic PAs cut the patient's waiting time by over 50%, reducing delays in medication dispensing and significantly enhancing patient satisfaction. The fifth benefit is regulatory compliance and reporting. How many of you have participated in a CMS audit? For those of you that have, you understand the importance of proper documentation and reporting. It's vital, to say the least. In, an inoperable system ensures accurate and timely reporting of data, especially when it's a requirement for regulatory compliance. This reduces the risk of penalties and enhances transparency within the healthcare ecosystem. For instance, consider the stringent reporting requirements for controlled substances, right? An inoperable system can automatically track and report the dispensing of these medications, ensuring compliance with the state and federal regulations. This automation not only minimizes the risk of human error, but it also streamlines the reporting process, freeing up resources to focus on patient care. It's the reason why we all signed up for healthcare, right? Another example is seen in the implementation of the prescription drug monitoring program. Many states have mandated the use of PDPs to monitor the prescribing and dispensing of controlled substances to combat the opioid crisis. Inoperable systems play a crucial role in ensuring that data from the pharmacies and healthcare providers is accurately reported to the PDP in real time. Consider a scenario where a patient is prescribed an opioid medication by multiple providers. Without the integration of data, it's challenging to detect such patterns, leading to potential overprescribing and abuse. However, with an integrated system, all prescriptions are recorded in the PDMP, allowing providers to see a comprehensive history of the patient's medication use. This helps in identifying potential abuse and taking necessary actions to prevent it. The sixth benefit is improved patient engagement and satisfaction. Have you ever worked with a healthcare provider who perhaps doesn't have all the bells and whistles and technology? You may have to hold for a long time to get the information that you need, or maybe leave a message and wait for someone to call you back. Having integration improves patient engagement and satisfaction by streamlining access to the information and reducing the need for manual communication between providers and patients with methods such as phone calls. According to a study published in the Journal of the American Medical Informatics Association, healthcare organizations that implemented inoperable systems reported significant improvements in patient satisfaction. Specifically, 85% of patients surveyed stated that they were very satisfied with their healthcare experience when their providers use inoperable electronic health records. That's amazing, right? The improvement in satisfaction can be attributed to several factors, such as reduced wait times, improved communication, and improved coordination of care. Those are just a few examples of the key benefits. There's many more, but inoperability has clear benefits that will improve our healthcare system. Next slide, please. So as we've seen, the benefits of interoperability in healthcare are vast. However, the absence of interoperability can lead to significant challenges and pitfalls, impacting not just the efficiency of our system, but more importantly, the patient lives. To illustrate this, I'd like to share a personal story that highlights the critical importance of interoperability. It's a story about my youngest daughter and the hurdles we face due to the fragmented healthcare system. This experience really highlights the real world consequences when our healthcare system fails to communicate effectively with each other. This is a picture of my daughter, Sophia. She's a bright and active 10-year-old. In the midst of her soccer season this year, she came to me complaining of a sharp pain in her side. As a parent, seeing your child in pain is one of the most distressing experiences, and my immediate response was to get her checked out quickly to determine the cause of her symptom. Concerned, my husband took her to the pediatrician the next day. Unfortunately, despite her escalating pain, the visit yielded no answers for us. She didn't get an x-ray, she didn't get lab work. That night, Sophia's pain woke her up in the middle of the night. She was in tears, which really prompted us to rush back to the pediatrician the next morning. So here's where my frustration began. At the X-ray facility, we had to fill out paperwork all over again because our systems couldn't communicate with the pediatrician's office. After wasting precious time, we discovered the referral hadn't even been sent. I had to go back to the pediatrician to get the referral to ensure Sophia could get the X-ray that day. Finally, after navigating all of these hurdles, we faced an agonizing 8-hour wait for the results because of the disjointed systems. In the end, it turned out that she only had a muscle strain, but the process to validate her diagnosis was daunting and stressful. This experience vividly illustrates the pitfalls of healthcare fragmentation. When systems don't talk to each other, patients like Sophia suffer. Imagine if her condition had been worse, all because her medical history wasn't accessible at a crucial time when we needed it most. You see, interoperability isn't just about convenience, it's about patient safety, quality of care, and enhanced customer service. When healthcare providers can seamlessly access a patient's complete medical history, they make better informed choices, reducing the risk of being misdiagnosed or having delays in treatments. Did you know currently only 60% of hospitals in the US have integrated systems? This fragmentation is a barrier to effective healthcare delivery. By breaking down these silos, we can ensure that critical information flows freely between providers, clinics, hospitals, pharmacies, ultimately improving patient outcomes and satisfaction. Imagine a healthcare system where your medical history follows you seamlessly no matter where you go, where providers collaborate effortlessly to provide the best care. That's a promise of interoperability, a system where every piece of data contributes to better health outcomes, where patients like my daughter Sophia can receive timely, accurate care without unnecessary delays or paperwork nightmares. As we move forward, advocating for comprehensive interoperability isn't just about efficiency, it's about advocating for safer and more effective healthcare for everyone. Next slide, please. As we've seen, interoperability in healthcare isn't just a buzzword, it's a game changer. It's about seamlessly connecting the dots to enhance patient care, improve outcomes, and ultimately transform the way people experience healthcare today. Now, envision a solution where healthcare stakeholders can take complete control, forging new paths to better care and cost management. At Abarca, we're pioneering what we call the virtual PBM model, a revolutionary approach that empowers payers to redefine pharmacy benefit management strategies. But why is this model so significant? Sophia's experience highlighted the critical need for the integrated healthcare systems, where timely access to comprehensive patient data can mean the difference between quick relief or prolonged uncertainty. Abarca's virtual PBM isn't just about replicating traditional service, it's about leveraging cutting edge technology like Darwin to integrate and optimize diverse partners securely. So, what is a virtual PBM model? A virtual PBM is selecting the best partner and integrating them securely using a proven cloud based platform such as Darwin. This strategy lets payers gain control over benefit design, data visibility, and partner flexibility, all while aligning incentives and managing cost effectively. This model liberates health plans from the constraints of traditional PBMs, enabling them to deliver a tailored pharmacy experience that prioritizes member care and satisfaction. Imagine the freedom to choose. With a virtual PBM, peers aren't tied to a single provider, limitations, or performance. They can select and integrate diverse vendors to optimize healthcare delivery, reduce cost, and improve clinical outcomes. This flexibility ensures compliance with regulatory standards, access to real-time data insights, and alignment with your strategic goals, all while securely enhancing member safety, clinical outcomes, and experience. It's really a win-win for everyone. In essence, Avarka's virtual PBM model isn't just a concept, it's a transformative approach to healthcare management. It's about forging new partnerships, driving innovation, and redefining what's possible in pharmacy benefit management. Abarca is leading the charge in effective and secure interoperability and empowering payers to regain control of their healthcare destinies. Abarca is building a future where connectivity and collaboration pave the way for healthier and happier patients. Next slide, please. Now we're going to dive into Abarca's unique benefits of our virtual PBM model. The difference between a cloud-based platform and a non-cloud-based platform are significant in terms of technology, efficiency, scalability, security, and overall user experience. Darwin, our PBM platform, was purpose-built with interoperability at its core. Our virtual PBM model seamlessly integrates with over 110 existing APIs, housing over 80 in-house modules under the same platform, ensuring streamlined operations and enhanced collaboration. Darwin is a proven cloud-based platform setting the standard for PBM technology today. It's tested and provides unmatched reliability and scalability in the market. As a cloud-based platform, it gives our clients advanced accessibility, allowing access from any secure device such as a smartphone, tablet, laptop, or desktop. We offer comprehensive integration. All PBM services are consolidated under one unified model. From benefit design to member support, our integrated approach simplifies management and enhances efficiency. We also offer built-in auto-scaling capabilities, ensuring that our virtual PBM can grow with your needs, adapting seamlessly to change in volume and complexity. Our cloud-based system can easily scale up or down based on demand, allowing businesses to adjust resources and cost according to their needs. Abarca prioritizes data security with multiple certifications, including SOC 1, SOC 2, ensuring the highest standards of protection for sensitive healthcare information. With Abarca's model, you can gain the freedom to execute a best of the best strategy. Our model allows payers to select and integrate top-tier healthcare vendors, optimizing outcomes and member satisfaction. You gain freedom and flexibility. We also have a proven track record of delivering on-time implementations with our agile, award-winning project management team. This ensures smooth transitions and minimal member disruption. Our robust business continuity plan also ensures uninterrupted service delivery, safeguarding your operations and member care during unforeseen events. Abarca is more than a vendor. We're your trusted business partner committed to driving your success through innovation, reliability, and exceptional service. And with that, I will pass it on to my presenting partner, Kat, who will be sharing more about Surescripts and how we partner today to supercharge interoperability together.
Thank you, Viri. Hello, everybody. My name is Kat Katula. I'm a Principal Customer Success Manager here at Surescripts, and I support PBMs, health plans, and pharmacies. I'd like to take just a moment to thank Abarca for giving me the opportunity to present today, and I'd like to thank all of you for spending your time on this webinar with us. Surescripts was built to solve the complex problems facing the American healthcare system today. As an interoperability pioneer, we've spent over 2 decades delivering trusted health information directly into clinicians' electronic workflows, making it possible for them to deliver the best possible care. Our history of innovating at the center of healthcare gives us the unique ability to deliver on our purpose, which is to serve the nation with simpler, trusted health intelligence sharing in order to increase patient safety, lower costs, and ensure quality care. We continue to innovate today in service of our vision, which is to help healthcare heal itself through real-time cost and care information that dramatically impacts patients and those who care for them today and for generations to come. But we're not alone. Surescripts knows that truly useful healthcare innovation requires a collaborative approach. That's why we convene the Surescripts Network Alliance, which unites nearly all electronic health record vendors, pharmacy benefit managers, pharmacies, and clinicians across the United States, in addition to the other types of organizations you see listed on this slide. Now I'd like to take a moment just to talk a bit more about the partnership between Abarca and Surescripts. Next slide, please. Abarca and Surescripts have been working together for over 9 years, and we've partnered to implement several of the benefit and authorization solutions that you see here. Eligibility and formulary make it possible for providers to electronically verify patients' benefits and see plan level coverage insight. Real-time prescription benefit gives providers the power to not only determine patients' out-of-pocket costs, but they can head off cost or coverage concerns upfront with patient-specific data. And finally, electronic prior authorization helps patients get on therapy faster by providing a streamlined process for prior authorizations. Now I'd like to talk just a little bit more about why these solutions matter and what impact they can have on interoperability. Next slide, please. Without the insights from these benefits and authorization solutions, patients can be caught off guard by prescription costs and coverage issues, and treatment is often delayed. It's easy to imagine the impacts that these delays have across the healthcare ecosystem. Providers are frustrated when they have to try and find pricing for a medication or pursue a prior authorization. Pharmacists spend just as much time communicating with providers and insurance companies as they do consulting with patients. High out-of-pocket costs can lead patients to abandon their medications. Patients who are not adherent to their treatment plans may experience readmission or other adverse effects, and non-adherence could lead to an increase in avoidable death. But with benefit and authorization information delivered at the right time in the care journey, all of this friction can be avoided. Prescribers and pharmacists have the tools they need to find medication options that they can feel confident that their patients can access, afford, and adhere to. Let's talk a little bit about how these solutions have had a real-world impact on interoperability. Next slide. According to the Surescripts National Progress Report, which is published annually, in 2023, patients saw an average of $37 worth of savings when their providers switched them to a lower cost covered alternative. The path to medication adherence was smoother for prescriptions informed by real-time prescription benefit, which experienced a 3.2 percentage point pickup rate gain. And when a prior authorization was necessary, the average response time was just under 4 minutes, which helped patients get on their therapy faster. I'd like to bring my portion of this presentation to a close by taking everything that we've talked about so far and putting it into the lens of a patient. Next slide. This is Andre. Andre is not a real patient, but his story is a common one. And thankfully, Andre is going to have a better experience than Viri and her daughter Sophia did, thanks to the fact that his care team is leveraging the benefits and authorizations insights. So our story with Andre starts when he makes an appointment with his physician, just for a routine checkup. A few days prior to the appointment, the electronic health record vendor automatically determines if Andre is still eligible for the coverage that they have on file using the Surescripts eligibility solution. During his visit with his doctor, Andre discovers that despite his best efforts to eat better and exercise, his blood pressure is still high. So his doctor recommends he tries a new medication to help with his blood pressure. Next slide. Andre's doctor deliberates between two different types of hypertension medication. Thanks to the Surescripts formulary solution, Andre's doctor is able to determine which medications are covered on Andre's insurance plan and which require a prior authorization. His provider chooses a medication that does not require a prior authorization, and he also has access to real-time prescription benefit, which allows him to verify the actual price that Andre will pay when he arrives at the pharmacy and make sure there aren't any other cheaper alternatives that are covered by the plan. After Andre and his doctor have a discussion about which medication is right for him, his provider sends the prescription to the pharmacy. Next slide. As Andre's leaving his appointment, he thinks to himself, well, since I'm going to the pharmacy, I may as well refill my asthma medication. The pharmacist receives the request for the refill of the inhaler and notices that since it's been quite some time since the prescription was last filled, Andre's formulary may have changed, which could impact his out-of-pocket costs. The pharmacist leverages real-time prescription benefit to identify an alternative medication that is a lower cost for Andre and is covered by his insurance. After discussing this change with Andre, the pharmacist uses our exchange to send an electronic suggestion for the alternative medication to Andre's doctor, who reviews the request and returns an approved response. Once both medications have been filled, Andre picks up his prescriptions, and he's really happy with the lower amount that he has to pay. Next slide. After a few weeks of taking his blood pressure medication, Andre notices some side effects that he's concerned about, so he calls to speak with his doctor. Andre's doctor agrees to change him to a different blood pressure medication, but notices that this time it's going to require a prior authorization. So Andre's doctor submits the request for prior authorization using the Surescripts electronic prior authorization solution and receives an approval in a short time. This helps eliminate the need for any manual processes that would have taken extra time and helps Andre get on therapy faster. Andre is now enjoying a side effect-free life, which is ultimately what we would hope to have happen. Now, I know that's a lot, but we all know that patient journeys are incredibly complex. Thankfully, with benefit and authorization information that Surescripts delivers in partnership with the Network Alliance, trusted health intelligence sharing is simple. And that real-time cost and care information dramatically improves the lives of patients and the people that care for them. Thank you so much for your time. Viri, I'll hand it back to you.
Thank you, Kat, for your collaboration and partnership on this webinar. We are truly thankful for all the work that we do together and for your support for this webinar. And thank you for the audience, everybody watching today. We hope that this was an insightful discussion on interoperability in healthcare. I really hope that you found the information valuable and inspiring. I truly believe by working together to break down data silos, we can create a more connected and efficient healthcare system that truly benefits the patients and providers alike. Thank you again for your time and participation. We look forward to staying connected with you guys and continuing this very important conversation. If you have any questions about the webinar or Surescripts or Abarca, please feel free to reach out and connect with us using the codes below. You can scan them and we will reach out back to you and answer any questions that you may have. Have a wonderful day. Goodbye, everyone.